Hey everybody, today is Tuesday, May the 9th, and I wanted to give an update on how things are going with recovery from my septoplasty, turbinate reduction, and maxillary sinus surgery that I had done 8 days ago. I just got back home from the doctor a little while ago. It's the first post-op checkup that I've had done, and I finally got my splits removed. I'm so happy about that. It's such a relief. I don't really feel any different than I did before I got them removed, but I don't feel, the annoying presence of something jammed up my nose that's 3 inches long. Uh, Other than that, everything else is the same. I'm still very congested. I still have a lot of pain in my mouth area, the front teeth, the upper lip, and the roof of my mouth. And that's making it a little hard to talk. I'm not able to move my top lip like I normally do when I speak, so I look a little funny when I talk, and I know I sound funny and congested. But I wanted to give the update on split removal. I know a lot of people have a lot of anxiety and trepidation when it comes to having splits removed, and so I just wanted to give my experience real quick for anyone who's curious. So I went to the doctor and went into the exam room and was sat in the seat, and the doctor came in and gave me a bedpan like you use when you throw up at the hospital, and just told me to hold that under my nose, and he gave me some tissue, and then he brought his tools over, and he used some scissors, I believe. I wasn't really looking, but I think he used scissors or some kind of snippers to snip the sutures that were holding my splits in place. And then he took some tweezers and put the tweezers up in one nostril and just grabbed a hold of the split and told me that he was ready to pull it out, and out it came. And he did that on both sides, of course. I did not really feel any pain with this. I've read a lot of people's experiences and watched a lot of videos of people who had a lot of pain with this, and saying that it was the worst part of the surgery. But for me, there really was no pain. I'm not sure if that's because of how well I took care of my nose post-operatively, or if it's just because I'm a hoss. Maybe it's both. But it wasn't a big deal to me. I'm so glad to have them out. It is such a relief. I was irrigating my nose many times each day and will continue to do so. I had heard that you can't irrigate too much, so pretty much every time I was up, whether I was going to the bathroom or the kitchen, I did irrigate my nose with saline spray, and I don't know if that helped. I know it kept things very moist in my nose, and the doctor commented how moist things were and that he was happy to see that. And I know that that reduces the amount of scabbing and dryness up in your nose, and maybe that's why it didn't hurt so bad. I'm not really sure, but I did fine. So no dizziness, no feeling like I was going to pass out, nothing like that. I did drink a protein shake before I went in just to make sure that I wasn't on an empty stomach and that my blood glucose levels weren't low. And I just went in there and had it done. He told me as soon as he pulled them out to go ahead and blow my nose, and that was a very weird experience for me. For the past week, I've wanted nothing more than to blow my nose, but was not allowed to post-operatively, and I did not give in and blow my nose at all. I did not want to damage anything, and so I just dealt with the discomfort and the congestion. So to finally be told that I need to blow my nose it felt unnatural. I actually asked the doctor if he was sure that I was supposed to blow my nose, and he laughed at me. But I'm not able to blow it hard, even though he says I can. It just feels like I'll hurt something or damage something, and I'm still in the phase of recovery where I want to protect my nose and make sure that I'm not doing anything to hurt it. Um, so I am blowing lightly. I was supposed to do that to get snot out. My doctor wants me irrigating my nose 3 times a day with saline. I wanted to be able to use a neti pot, but he wants me to hold off on that until I see him in a month from now. And hopefully then, if I'm still feeling congested and stopped up, I could use a neti pot. I don't use one normally, but with the amount of congestion I feel, I do feel the desire to be able to use a neti pot. Um, I will still be taking ibuprofen for inflammation, and still be taking it easy because I do still feel very flu-like. I feel like I'm running a fever. I feel very congested. I feel tired. Some body aches. And the doctor said that I would continue to feel flu-like for the next several days, and I would also feel congestion and have inflammation for the next several days. But he said as the congestion starts to resolve itself and the inflammation starts to decrease, that I would feel less and less like I have the flu. So I'm looking forward to that. But for now, I really don't feel much difference between having the splits in and not having them in, other than just not actually feeling the splits themselves. So other than that, he gave me the all clear to be able to sit in my hot tub again and to swim if I want to, but I don't really want to right now. And to do normal things. He did say the pain in my mouth and my teeth would take probably a couple months to go away. He had to remove a lot of bone during my septoplasty, and so he said the nerves were just going to take some time to heal, and that I would hopefully start to get more and more sensation back as time goes on, but it would take a couple months. So that is pretty frustrating, but I am tolerating it. Still not able to eat very solid foods, getting better and better with that. I would like to be able to move my upper lip. I would like to be able to laugh and smile. Right now it still hurts very bad to try to laugh or smile in any way. So hopefully with time that will resolve itself. But I will update again in a day or two and let you guys know how things are going with the congestion. But I'm so happy to have the splits out and just feel like I'm finally going to be able to start true recovery and getting rid of some congestion and inflammation. So if you have any questions, feel free to comment, and have a good day. Bye.